I'm Sagi Josefsberg Ben Yoshua. I'm the director of the Clinical Genetic Institute in Kaplan Medical Center in Rehovot. We are a service that provides genetic services, counseling services, and we deal a lot with prenatal services. So we've been using the CytoScan 750K for a few years, and this is part of our regular service that we provide. And now we're happy to say that in Israel, all labs that do amnios prenatal testing, they all have to do, they all use CMA as part of our regular service. The big work or big things that I'm very excited about in the last, and I've been dealing with in the last 2 years, is expanded the carrier screening. The huge advantage of carrier screening of the system is that it's pan-ethnic, it's relatively simple to use for the lab. There's no curation data, curation required, which makes life much easier. It's very robust, so you can do it to many people. The cost is relatively low. And again, the huge advantage that with one system we can do all testing, that it includes both a single variant mutation and the other advantage that it could do deletion and duplication. It makes this system really robust and amazing that we can do all testing in one basically experiment or one test. In Israel, Israel was probably one of the first countries or nations in the world to start genetic screening. And we will commemorate 50 years of screening in the near future, basically when Israel started to do Tay-Sachs screening for the public. Now, the current system that is used in Israel is mainly testing, carrier testing for specific disorders according to the mutation known in that population. For example, you would test the whole population for Fragile X, SMA, and cystic fibrosis. And then according to the specific ethnicity versus Ashkenazi Jews, you would test for a few disorders, Sephardic Jews for different disorders, Druze from Israel, different disorders, Muslim Arabs from the north of Israel, you would do some mutations versus Bedouins from the south of Israel, you test different. So every population we would use specific tests. We would use many different tests or many different runs in the lab for each individual tested. Now we're at the time that we can do all these testing in one test, again, except for Fragile X that is done on a different run, different lab test. All other testing, we do one run for the whole, for everything that we want. In one test, we could test for thousands of mutations or deletion duplications, hundreds of different disorders. And we can, the nice thing about the system is we can expand as we have more knowledge or we know of different need for a specific mutation, we could always add this to the test in collaboration with Thermo Fisher. When we started implementing the system in our lab, it's a lab that already has a lot of experience with genetic screening. Basically, it was very simple. It was never a big issue. There was a 2-week period of training, and it seems to work very, very well. From the lab perspective, you save so much time because previously, for much less testing, we would need to run many more tests versus now on one platform, one test, we run all these tests together. So it was very easy to implement the system into our lab, which already has experience in testing. So it was never an issue. And what is very exciting is that we're at a stage where we can, I think, make a huge impact on our population. And what we're now trying to work with is with the government, with the Ministry of Health, with the genetic community, with the different payers, that they all have to understand that we have to implement the system. The costs of the new system are not totally different from what we're paying now, but we will get much, much more. So the big hope is that we're staged, that the technology is here. The costs are not totally different from what we're paying now, but we can make a huge, huge impact. So I'm very excited that we're at this stage right now. And NGS, I think still in the near future and for the next couple of years, there's so many issues of curation. It's much more difficult. It's not always a very simple test to detect deletion duplication, or you can do it, but then the cost is much, much higher. That's why we had lots of expectation from CarrierScan, and I must say that we were much happier. We were surprised on how well it worked. The curation was basically, you don't need to do curation. The system worked much better than we expected. If we talk about false positives, false negatives, the numbers were, from my perspective, amazing. We thought we would have a lot of failures or a lot of testing that there would be no calls or other issues, and we were really surprised on how well it worked. When we compared our system with the testing that we have done on the testing with CarrierScan, and all our positives were all picked up by the system, and then we picked up many, many more that we did another test just to confirm. So everything really worked nicely, much better than we thought it would.